I am a respiratory therapist, and currently we have more than 100 COVID patients at my hospital. As a respiratory therapist, we take care of these COVID patients both in the acute care and the general care setting. In the acute care setting, which is our ICUs, we have about 50 or more of those patients that are on ventilators. And as a respiratory therapist, we manage the ventilators. We have many different modes of ventilation that we use. As these patients get sicker, they require particular modes, and they require a specialist that knows how to use these modes. We've actually seen a lot of young people. When they first started talking about this disease, they mentioned, people that were over the age of 60 or that had a lung disease or other comorbidities, but they never really described those. We're actually finding that the hardest hit people are on the younger side. Currently, out of those 100 COVID patients that I mentioned, a lot of them are in their 30s, 40s, and 50s. Most of them are not over the age of 60. We have a few, and they are the sickest of the sick. They are the ones that are on the ventilator. They're the ones requiring the biggest need of a respiratory therapist. And they are the hardest for my staff to manage emotionally, I think, because they are so young. Being able to help someone breathe or make their breathing easier is the most rewarding thing. I can't even describe, I don't think, how rewarding that is to me personally. I am very fortunate to have been doing this for 30 years. I wouldn't trade it for anything. I've had many opportunities to go to different things, and I've always chosen to stay at the bedside helping people. If someone is thinking about becoming a respiratory therapist, I say do it, please. Respiratory therapy is such an important field. As anyone can see now, there's such a shortage. We've found during this COVID situation that we do not have enough. And we really need people to be able to help save these people's lives and to be able to help them get home to their families. So if you're interested, shadow a respiratory therapist, come shadow me, but please consider that as a profession.